Hello everyone, this is Dr. Parinaaz Parhar, Clinical Head Oasis Fertility Secunderabad. Today I will be talking about IVF. IVF is in vitro fertilization. As the name tells us, it means that we are fertilizing the eggs outside the body in the laboratory. This is what was known as test tube baby in the past. Now, IVF is based on the basic concept that normally in a lady whose regular cycles are happening every month, one egg is growing. In IVF, we try to make as many eggs grow in a particular menstrual cycle by giving the lady injections for about 10 to 12 days. We're hoping to get somewhere in the range of about 10 to 15 eggs. The number of eggs which we get depends upon the lady's ovarian reserve. Once these eggs have grown to a size of about 17 millimeters or more, we expect them to be of the right size for maturity. And once we have given them an injection to help them mature, 34 to 36 hours after this trigger injection is when we post the patient for an oocyte retrieval. Now, the egg retrieval is done in the OT under general anesthesia using a needle which is passed through the lady's vagina, and the procedure is done under ultrasound guidance. This is a fairly safe and painless procedure because it's carried out under anesthesia and under ultrasound guidance. Post-procedure, the patient is discharged in about 2 to 3 hours. The eggs which are taken out from the body are combined with the male partner's sperm in the laboratory by either a procedure of IVF or ICSI. Post-fertilization, these eggs are grown in the laboratory for about 3 to 5 days as embryos. And after that, based on the quality of the embryos which are formed, they might either be frozen for transfer at a later date, or they might be transferred in the same cycle in the patient's body. Now, IVF as such has a success rate of about 40 to 50%. The success rate is remarkably more than an IUI cycle, which shows only about 10 to 15% success rate because it's a very controlled process. We're taking out the eggs from the female's body and combining them in the laboratory with the sperm. And once they have fertilized and become embryos, we are putting them into the uterus once we are satisfied that the lining is good to support a pregnancy. Because of the sheer controlled nature of the entire program, the success rate is as high as 40 to 50%. The more the number of embryos that we form from a particular cycle, the higher is the cumulative pregnancy rate. That is the number of pregnancies that can result from the eggs which are formed in one cycle. The success rate to a large extent depends upon the age of the female partner. But let us remember that it's the embryos that are going to be transferred. So it's both the egg and the sperm which make a contribution. Even the semen parameters need to be good. That is the main reason for a good almost a month or two before the IVF procedure starts, your doctor will assess you based on your history, and based on your previous history, your ovarian reserve, as well as other details of your case, will be putting you on some medications and antioxidants to try improve the quality of both the eggs and the sperm. Because of the nature of the process, patients who stand to benefit from IVF, especially are those who have some kind of problem with the tubes. Because IVF totally bypasses the tubes, patients with tubal factor, where the tubes are blocked or have fluid in them, really stand to benefit from the procedure of IVF for fertility treatment. Also, patients where the male partner's sperm count is very low can go for IVF or ICSI directly. Thirdly, also patients where the patient's age is more than 35, where the female partner's ovarian reserve is very low. In these cases, we as fertility specialists usually encourage the patient to go for an IVF directly because of the higher success rate that it promises. Hope you found this video helpful.
For more information and updates, subscribe to Oasis Fertility. Hit the bell icon for future notifications.